Hi, my name is Shirley. I had a living-related kidney transplant in January 2015. That means that both of my kidneys were not working, that they had failed, and I was not clearing waste products or controlling fluids very well. I was diagnosed with membranous nephritis about 10 years ago in 2005. This is a form of glomerulonephritis, which causes the membranes within the kidneys to become inflamed, and they start leaking large molecules such as proteins. This caused the development of nephrotic syndrome, which is a syndrome which causes high cholesterol, high triglycerides, a great loss of protein through or albumin into the urine, which causes symptoms such as swelling of the legs or swelling of the face, high blood pressure, high cholesterol, high triglycerides, those kind of symptoms. The cause is unknown or idiopathic, but some theories are that it could be possibly a virus that causes this to happen to the kidney. Another theory is an autoimmune disease where your body is attacking itself. A third is possibly genetic, that it could be carried within families from one generation to the next. My mother also had a glomerulonephritis disease, and she was in end-stage renal disease and on hemodialysis for 12 years. But they had told me that my membranous nephritis has very little relationship to her type of disease. Over time, with nephrotic syndrome, I was losing about 14 grams of protein into my urine, when a healthy kidney does not lose any, usually doesn't lose any protein, or less than 3 milligrams of protein is considered normal. I found out I had the disease because of leg swelling that occurred. I also had all the other symptoms. I developed high blood pressure probably 10 years before they diagnosed the kidney problem, but I do think that it was related to that. At the time, though, we did not know it was related to the kidneys. I had my kidneys worked up at the time, but they couldn't find anything wrong. The swelling of my left leg and a low albumin level were signs that caused the doctors to look at the kidneys a little closer, and they discovered that I had already lost 50% of my kidney functioning by that time. To try to put the disease into remission, I was treated with prednisone and a anti-cancer drug called Cytoxan for about 8 months. This was in an attempt to knock the immune system out and reset it to stop attacking the kidneys, and it did slightly work. For about 3 years. Instead of losing 14 grams of protein, I was losing 1 to 2 grams of protein, which is a great improvement. But at the end of the 3 years, the loss of protein started all over again. The treatment of Cytoxan and prednisone, at that time I became very, very tired, anemic. My immune system was very weakened, so I had to be careful to not come in contact with anyone with any colds, viruses, or any other kind of diseases that you could catch. It was a very dangerous period of time. I was on that for about 8 months, but it did put it into that slight remission for 3 years, which was good. The second time, when I started losing about 14 to 16 grams of protein, we tried a different immunosuppressive. It was along with prednisone, but it was called cyclosporin. It was a anti-rejection drug, usually used for kidney transplant patients. The funny thing is that cyclosporin in itself is nephrotoxic, it means that it's very poisonous to the kidney itself, and that once you're on it, supposedly you had to be on it for the rest of the life of that kidney. However, because of the symptoms and it was not working, we decided to get off of the cyclosporin. And at that point, that's when the kidneys took a major dip and started to fail. What they call our glomerular filtration rate dropped from 50 cc's per minute. That's how much the kidneys clears of blood per minute, dropped down to 10 cc's per minute. And at 10 cc's per minute, that's considered that it's not keeping the cells of the body healthy enough for you to survive, and that you need some other form of treatment, such as a peritoneal dialysis or a hemodialysis or a transplant, kidney transplant. I started on CAPD, which is continuous ambulatory peritoneal dialysis. I was being trained on it. I had a catheter placed. Before that, though, we decided that we were going to sign up for, I was going to sign up for the kidney transplant list. And in January, February of 2014, I went to University of California, San Francisco, to sign up for the kidney transplant list, and had 2 living-related donors who were willing to provide me a kidney, which I am truly blessed for, because many people have to stay on the kidney transplant list for several years. It's an average of 3 to 5 years for even a cadaver transplant, and living-related is a lot better than a cadaver transplant in some terms. So in 2014, I had numerous blood tests, DNA tests, tissue typing, chest x-rays, EKGs. I met with a transplant surgeon several times. And like I said, and during this time, my kidneys were failing, only clearing 10 cc's of blood per minute. And I started to learn CAPD and intermittent peritoneal dialysis for nighttime dialysis treatments. And this is a catheter is placed into the peritoneal cavity of the abdomen, and fluid, electrolytes and sugar fluid is put in the peritoneal layer, and the exchange between the peritoneal membrane itself, there's an exchange of fluids and electrolytes to clean my bloodstream so that I can still live. And so I was learning to do that. It was the donors that had a more stringent workup with the blood typing testing, DNA testing, CT scans, chest x-rays, mental assessments. They had to be 100% healthy physically and mentally to give me a kidney. They had to make sure that they were giving me a kidney for the right reasons, and that they were mentally capable of handling the loss of their kidney and the possibility if the kidney did not work in me or I rejected the kidney in the future. Both of my husband and my brother were compatible, but my brother had 6 out of 10 chromosomes matching mine. My husband had 1 out of 10 chromosomes matching mine, so my brother was a better candidate for me in that my body would possibly not reject it as much as my husband's. Because my natural kidneys were leaking a lot of protein still, we decided to remove both of my natural kidneys so that we could tell that the new kidney was working healthily and well. We set it for January of 2015, January 20th of 2015. We arrived there that morning. The donor arrived there, and I arrived there, the recipient. I went into surgery first because I had to have my 2 kidneys removed and my catheter removed. What I was told by the surgeon, which is interesting of how it was done, is that he would remove my left kidney and put it in a plastic bag through like a 2-inch incision and put it into, lay the plastic bag with my kidney into my abdomen cavity. Then he would open up my right kidney, a larger incision, so that he can reach in there and remove that left kidney. And then he would remove my right kidney. I did have some issues, like I said. It took 9 hours instead of the 5 hours for them to do the first surgery. And also that after the surgery, for 24 hours, my kidney was not really working well. It was not making urine, and so they had to go back into surgery. They discovered it was not getting enough blood flow, and they found a iliac artery pocket that was catching the blood and was not allowing it to get to the kidneys or to my right leg. And so the surgeon had to remove the donor kidney totally out of my body, and search for where the problem was. And he did find it, reattach that iliac artery the correct way, put the kidney back in, which was amazing. And after that took another 5 to 6 hours, and then the kidney worked, and it worked very well. I started making urine right away. It was a little slow, not a lot of urine, but enough that we know that the kidney was alive and working well. I was discharged from the hospital within 7 days from the first surgery, 5 days from the second kidney transplant. And since that time, my blood pressure is back to normal. My cholesterol and triglycerides are back to normal. I'm no longer anemic. I'm doing well. I'm making urine. Everything is fantastic. A lot of living-related transplants, kidney transplants, do live up to 20 years, and I'm hoping for the best. And so I'm living one day at a time. And I thank my donor forever. And I thank you for listening to my story.